Well, Dan, it looks like we're live.
Yeah, looks like it.
We're we're entering all the folks into the room right now. Uh, Looks like a few more people are coming into the waiting room, so we'll give them a couple of seconds. I know that we're entering them as we speak. First of all, thank you all for joining us in this post-election impact webinar or briefing that we're holding. I'm Brian Feely, by the way. I am the Senior Vice President of Marketing at Corporate Synergies, and I'm really happy to have with us today someone you may already know, many of you, and that is Dan Kuperstein, who is our Senior Vice President of Compliance. And we also have Dot on the line, Dot Summers, who is our Director of Compliance, the amazing compliance team known as dananddot.com, if you paid attention to some of those webinars. So thank you again for joining us. We're going to be covering a few of the topics that I'm sure is on everyone's mind. I mean, clearly when we set this up, we thought there was a chance that we might have an outcome, but at the same time, I think we also knew that this could delay for quite a few more days. But I will tell you that I think we have enough information to be pretty informative for you on some of the topics that are going to be coming up. Having just gotten off a call with some folks that are very in tune with what's happening within the Beltway. So I'll turn it over to Dan, maybe ask some questions as we go along. But Dan, you and I were just on a webinar with some of the folks that are on a first name basis with Congress. And maybe you start off by sharing with everybody some of the intel that we got just a few moments ago on the status of the election as it stands right now. I think that would be of interest.
Great, thanks, Brian. Yeah, so I think from a big picture perspective, I think what you can probably see from just turning your TV on right now is that it looks like as far as the presidency is concerned, right, it does look like Joe Biden is likely to clinch the 270 and become announced the president. That doesn't mean necessarily that it won't be challenged by our existing president, Donald Trump, and that there will likely be legal cases that will be challenging that. So, obviously we're not going to comment on any of those cases. Some of the early cases have been dismissed by Republican judges in some cases, but obviously it's too early to tell what's going to happen with those. But when it comes to the House and the Senate, it looks like the House is going to be blue again. Is going to go Democrat. And it does look very likely, although it's not 100% in the bag yet, but it looks like the Senate will go Republican. There's still some decisions that will have to come out of Georgia and North Carolina, but as of now, it looks like we are going to see a very similar situation in Congress than what we saw prior to the election. Despite what I think a lot of the polls were saying, a lot of what the news was saying about a blue wave or even a blue tsunami. It does look like things are pretty much status quo with the exception of the presidency. So we'll see, and obviously from what we're hearing, as far as the first priorities of the new Congress and what might have happened in the interim in the lame duck Congress, some of the obviously the top thing for the Democrats is COVID-19 relief. It is still a priority it seems like for almost everybody at this point, and continuing some kind of stimulus. We have heard from our lobbying organization in DC that it does look more likely that there will be some kind of COVID-19 relief or stimulus in the lame duck session prior to all of the new freshmen coming in and the new session. We are also looking at as far as healthcare and employee benefits. Some of the issues that will be top of the list of priorities will be to increase price transparency. There was regulation that came out end of October that will be going into effect in 2022 and later plan years. We'll be releasing something on that, but that regulation talks a lot about price transparency for insurance companies, and also self-insured plans would have to deal with a lot of these rules if they ever do go into effect. There also looks like there is some bipartisan support to enterprise medical billing, which is something we've been talking about for a long time. And of course, there is bipartisan support to lower prescription drug costs, including looking at drug importation measures, which we've also talked quite a lot about, although there is a very strong lobby on the pharmaceutical manufacturing side. So that one may be a little bit harder as far as as far as the agenda is concerned. But that's kind of the big picture.
Yeah, it's interesting, Dan, just listening to the folks that deal with this every day, and when they were talking about pharmacy and the pharmaceutical industry, they looked at it not as a partisan issue. It was interesting to hear them say that it's the world against the pharmaceutical industry as it relates to trying to reduce costs. And they were talking about not only importation and complete transparency, but I was interested to hear how they were really pushing on the whole idea of, commercials being banned for prescription drugs, and like really hitting it from all different fronts.
Yeah, no, that's very true. And I think that's an area where there can be a lot of room for us to see a change in benefit plans in the very, very near future. And I think it's important too to remember one thing, that as divisive as it may seem in the news, especially when you turn on CNN or major news channels. I think actually one of the people on that call said, it's I can't remember the exact quote, but basically that the media kind of thrives on the conflict more than convergence, which I thought was pretty good quote. But it seems like in many cases there is a lot of room here for bipartisan healthcare proposals that will work, and that will also even potentially help stabilize the ACA and bring it back to a little bit more of what it was like prior to the Trump administration. But one thing to remember, of course, is that Mitch McConnell and Joe Biden have a long history together. They have working together and passing laws together. Mitch McConnell actually showed up at Beau Biden's funeral, which was very telling, and it shows just how close they are. So it's just something to remember, that they may not seem as divided as it may look to you when you're just watching the media.
Yeah, when you hear people who are sitting in the offices of these senators and are involved in some of the the committees that are making decisions, I was kind of taken back, because all we hear on the news is the divisiveness. But to hear how they work very well together, and that these senators across the aisle, they have been reaching out. All you're hearing is the surface related stuff. You're not seeing what's going on behind the scenes. But so that maybe, as they said, looks like we're going to be going back to a more moderate and traditional, government, and the way in which they're going to hopefully work together. That being said, there's a few things right around the corner. It's November 6th. What's the next big thing? Only a few days away, right, Dan?
Yeah, so I think we're all watching, at least us on the compliance team and marketing and everyone in our company is going to be watching very closely what happens on November 10th, when there's going to be arguments before the Supreme Court in the Texas case, the case about the constitutionality of the Affordable Care Act. And of course, it's going to be a different court now that we have Barrett replacing Justice Ruth Bader Ginsburg. So it's going to be very, very interesting to watch how those arguments play out. A decision could come as early as March or April, and certainly before the end of June. And what we're hearing, from all of everything I've been reading from our insiders in Washington, is that a lot of the legal scholars are saying it's definitely likely that the individual mandate component of the ACA will be held to be unconstitutional, which, look, we've been living in that world now since the beginning of 2017. So we kind of know what that's like and how that's going to work. And so we're prepared for that. The issue is kind of what is going to be happening. What's going to happen with regard to severability, right? So that's the big question, right? Can the individual mandate be severable from the rest of the Affordable Care Act, or does all of the Affordable Care Act have to go away? And it looks like, from all of the legal scholars I've heard from, and I've actually also attended many other, webinars and spoken to my, colleagues that are more involved in this area, it does look a lot like, even if there is some kind of severability component that's upheld, and some component of, hey, some other parts of the ACA have to be struck down, it's much more likely that those will have to do with a lot of the individual healthcare provisions. So things like guaranteed issue and exchange coverage and pre-existing conditions, and it won't be as likely to affect the employer mandate and some of the rules that we deal with in the group health insurance world. So it may not create too much disruption in what we do every day, but it could still have a lot of disruption, obviously, if it overturns pre-existing conditions. Now, it doesn't mean it's the end of the world, of course, because, I think that they can, if we remember Donald Trump, President Trump had an executive order saying he wanted to protect pre-existing conditions. A lot of the moderate folks in the Senate want to protect pre-existing conditions. So it doesn't mean, I don't think, in any way that this is the end of the ACA and the end of pre-existing conditions, but it could lead to some potential disruption that we'll be watching very closely.
So on pre-existing conditions, yeah, because that was a big deal all throughout the debates and what have you. Everyone arguing that the Republicans were going to get rid of it, right? That was a known fact. But of course, they would say, no, of course not. But there was that bill out there, right? So yes, okay. Assumption being that there's going to be a President Biden and the Congress is going to be made up somewhat similarly the way it is today. What happens to that in your mind? Is that all part of what we're going to be seeing on the 10th? And based on the confirmation hearings, kind of we've got a little bit of a sneak peek as to the fact that they're going to sever that one clause and things are going to be pretty much straightforward for at least another couple of years.
Well, from my understanding, everything I'm looking at as far as potential outcomes, it looks like there's probably three very likely outcomes, right? It's very unlikely that they're going to uphold the original ACA individual mandate and all, and uphold everything else, right? The most likely outcomes are that they're right? They're going to just get rid of the individual mandate. That's unconstitutional, and that pre-existing conditions and everything else, right? That can be severable, right? So that means that pre-existing conditions, everything else goes, is still in effect and still
Right.
out. The other issue is that it's inseverable entirely. The entire ACA is overturned. We have to come up with a new Part 2 ACA, right? That's very unlikely to happen as well.
Right.
It's a possibility with what we heard from confirmation hearings, which actually we should say what Justice Barrett wrote in law review articles and what we know her views are and what the way it could possibly go. It could possibly go there, in which case we would have to look at the dynamic really between Mitch McConnell and President Trump and their ability to work together to create the next healthcare plan for our country. Very unlikely that could happen, but if that does happen, it is likely that there will be some protections for pre-existing conditions in that second Part 2 package. One thing to note, of course, is that, and this was one big criticism of the president, was that he kept on saying he wants to protect pre-existing conditions. He even signed an executive order to that effect, but he was trying to, he was a part of a complaint in this case to get rid of the entire ACA, including pre-existing conditions. And there was never any formal plan sent forward from the Trump administration about how to define pre-existing conditions, which led to a big concern that any Republican proposal for a Part 2 ACA legislation would have a big hole in it, for carve-outs of what that could mean. So carve-outs for COVID-19 or COVID-19 related diseases, right? That would be a very big concern for people. And so that was a big concern. Then, of course, I think the other, if we go back to, I guess, what would be the third option, which I think is probably the most likely, is some kind of combination of the first and the second big option as far as outcomes are concerned for that big Supreme Court decision, which is that the judges say, well, it's severable, it's inseverable for certain parts, right? They're related to, kind of going back to what I was saying before, right? Certain parts related to the individual mandate have to be stricken. But most likely they would probably, punt that to a lower court to make those determinations. But we're talking about things that are probably more related to the individual mandate, like exchange coverage rights, guaranteed issue, and things like that. And then, of course, that could also mean the removal of the pre-existing conditions, again, like I said. And that, of course, would mean that there would have to be some kind of probably legislation then would have to come into play where, again, that dynamic between Mitch McConnell and the president comes into play. So we're kind of looking at all of those things. I think it's probably likely that it will be either, just the AC. Remember, if we remember, right, we've been living without an individual mandate for a couple of years now. We kind of know what that looks like. Right. And the ACA is on, it's okay. There's no major crisis, right? It's not like insurance prices are going crazy. People are dying people are not, there is a pandemic going on, but I mean, it's not like the ACA itself is completely going crazy, right? Mm-hmm. So the ACA is still working, and without the individual mandate. And so that may be one big argument that the judges look at and say, this thing can continue as is without the individual mandate. But I think at the end of the day, to the extent that any of this stuff gets stricken from, ACA Part 1, we're going to be looking very, very closely at that relationship between what is likely to be President Biden and Mitch McConnell.
So Dan, aside from the things that we spoke about, and the potential likely scenario that we mentioned about the president and Congress, what keeps you up at night? What do you think are on the minds of our clients? I mean, you have a lot of meetings, you help navigate through a lot of complexities. What does your path forward look like as it relates to the big compliance issues that maybe would have gone away or not going away, or things that are going to be added? Where's your mind at for how our clients are going to need assistance moving forward?
Yeah, that's a really great question. It's something I've been thinking a lot about. I even had a conversation with my older brother, who's an NBC broadcaster, because he wanted to kind of learn a little bit more about what's really happening with the ACA. And so I had to talk to him last night about it. One thing I think what we're hearing from our clients is that it's just too much, right? I mean, the state by state sort of quilt, the patchwork approach of having all of the different COVID relief things and COVID, requirements at the state and local level. It's just too much, right? You've got all the different paid leave and COVID leave and paid sick leave and paid FMLA and insurance requirements at all different state and local levels. It's just overwhelming for most HR and benefits teams to handle that, right? And when it comes to benefits laws, I think they do, however, still want to see continued federal relief, right? So one of the questions I talked about on our last call, as we know, is that what could happen, right, to the CARES Act and the FFCRA. I think the CARES Act, the benefits enhancements that are available for medical plans, it does look like, at least as of now, assuming that there isn't some big holdup that happens or some issue that, with regard to these legal cases, which we don't know how they could turn out, but it does look like that there's real, support from the president and Congress, or from at least from Joe Biden to continue the CARES Act, continue the relief and stimulus of the COVID-19 at the federal level. But I think one advantage that we could really see to alleviate those concerns that we're hearing from our clients about all of these state and local compliance hurdles is a more federal approach. Now, that's, I think, one thing that Joe Biden really had in his pocket or maybe as a real feather in his cap in the campaign was he said, I'm going to federalize our response to COVID-19, right? We had a pandemic playbook in the Obama administration. We're going to go back to that. We've improved it, right? And we're going to make more of a uniform standard, right, across the board about how we respond to COVID-19. And I think if that can end up preempting or, superseding a lot of these very complicated and divergent, state and local COVID-19 requirements, I think that's going to release a huge headache for our benefits and HR managers out there. And I don't know if anyone, I'm sure a lot of you, I see some familiar faces out there in the Zoom audience are agreeing with me, right? Because if we just had one standard, one federal approach that made sense, that was consistent across the board, it'd be a lot easier. And it would be, and I think that the Trump administration, they said, let's kind of let the governors decide, and look, there's some value to that too. Let's be fair here, right? There's some value to, each state is different, right? Each state has its own rules, and some places there's more crowding with people, there's bigger cities, there's different issues, and I can understand that. But I think at least for our clients and for the HR and benefits managers that we speak to, right, they prefer to see just sort of one more uniform federal standard, right? That makes things easier for them. And I actually also do personally think that it's going to be easier to fight the pandemic when there's a more uniform kind of standard across the different states of this country.
Yeah, I mean, I'm sure a lot of folks would be looking forward to some sort of standardization. Just think about all the policy changes and everything that we have to put into our communications based on state. And it continually, we can have, as we've always said, we kind of joke around, and I know it's not a joke for those that have to deal with it, but paid family leave and all of the complexities of that, every time we have any kind of a webinar or seminar on that, it is just an endless discussion because of the complexities. I want to remind everybody on the call to make sure to take a look at your chat window at the bottom. You can enter any questions that you have for Dan and any of the others here. I know Dot's on as well. But if you have any questions about what impacts the election might have on you and your organization, put them in the chat window and we'll discuss it.
Actually, I see, Brian, there's a question here about pre-existing conditions and does that apply if there's a lapse in coverage? And right, that is an issue, right? So one issue that happened in the past, right, was that if someone had a lapse in coverage, they could be denied health insurance coverage if they had a pre-existing condition. So that was a big issue that we had prior to the ACA. And one of the other things, and I think, and I know Brian and I, we talked about this before the call, is this issue of these sort of alternative plans that are out there that came up during the Trump administration, right? What's going to happen to those, right? And one of those was designed just for this reason. It was called short-term limited duration insurance, or STLDI. And these short-term plans were kind of designed, they were really expanded their availability. These are plans that do not offer coverage that meets the ACA's minimum standards, but they really proliferated during the Trump administration. And from everything we're hearing, it looks like there's going to be some likely to be a big response to that, to get rid of that early on in this new post-election world that we're in. So that's one big change that we're going to likely see. And so the coverage will likely get more robust. When there are lapses in coverage, of course, it also has an effect on what's going to happen with the exchanges, what's going to happen with, one thing that there's a lot of concern about is this public option. Right? And I don't want to kind of get ahead of ourselves here too much in the conversation, but one big question that we get a lot from our clients is, what is going to happen if, it's easier for the ACA to be enforced against us as employers? What happens if they create a public option? What happens if they make it much easier for individuals to get premium tax credits on exchanges, right? And that's one thing that former Vice President Biden said on the campaign trail was, I'm going to make it a lot easier. I want to keep the Affordable Care Act. He made it very clear he wants to keep the Affordable Care Act. But he did want to tweak it to create a public option for individuals who do not qualify for Medicaid in their particular states, even if they do get an offer of affordable coverage. He didn't say affordable coverage. He just said even if they get an offer from their employers, but it's not necessarily clear what that means. And so a lot of people are thinking, well, does that mean an end to the affordability safe harbors, right, that we've come to rely on as employers offering health insurance to our employees? What does this really mean? And there's not a lot of detail really on that. In fact, it came up, and I don't know if you remember, if all of you watched those debates, right, there was a question in the most recent debate where it was asked to Biden, concerns that your healthcare plan, which includes a government insurance option, I'm quoting here, which includes a government insurance option, takes the country one step closer to a healthcare system run entirely by the government. And what's your response to that? And then Biden's response was, quote, I say it's ridiculous. It's like saying that the fact that there is a public option that people can choose, that makes it a socialist plan. And then he went on to just saying how he supports healthcare and things like that. But I think one thing that's interesting here is that, it does look a lot like more like a Medicare, for all plan in some respects. But every time, Vice President Biden is asked this question, right? Is this, is this going to become a Medicare for all? Is this going to become single payer? He always says no. He always says no. We're keeping employer-sponsored insurance. We're keeping, Obamacare. We're keeping the Affordable Care Act with just some tweaks. So and that's one thing that really kind of distinguished him, if you remember, from the Democrat debates, was that he really was much more middle of the road, right? A lot of other potential candidates that out there wanted there to be more of a Medicare for all system. And he was like, no, we're going to keep Obamacare. It's working, and I think that really, in some ways, that could have helped him win this election, right? Because he was much more middle of the road. People who like their employer-sponsored insurance could keep it, right? It would be something that would be much more, I guess you could say, bipartisan from a Biden administration than from some of those other folks that we saw, on the campaign trail.
Dan, it was interesting just what you said about that middle of the road position that he took on that certainly helped him. Apparently, listening to the experts on the call that we were just on, but what it didn't do, not at the presidential race, but at the Senate, the Senate races, the House race, all of that happening, there was that fear of those extreme measures that actually prevented the blue wave and prevented the tsunami. So I found that to be very interesting, that actually hurt the Senate races that were happening, while it helped Joe Biden at the presidential side. So anyway,
Yeah, it's very
politics aside, regardless of how you feel, it seems like that's the situation we're going to end up with in this next government.
It's interesting you say that. I talked to my brother last night, who is, he is a broadcaster in New York, so he gets to speak to a lot of the politicians. He was in DC yesterday speaking to a lot of politicians. And what he said was very interesting. He said he really thinks that was one of the reasons that Biden really got as many votes as he did, and why the Democrats won the presidency was because he said they really chose a candidate that was much more to the middle than everyone else, right? So this was their strategy. In other words, he said they were playing to win, so to speak. And even choosing someone who is much more middle of the road on healthcare than everyone else, right, was maybe not something that people like, maybe like AOC or, Elizabeth, all those other folks, right? A lot of those people would have been like, that's way too middle of the road for us. We want to do something much more revolutionary here. But I think that was the strategy of play to win. We're going to win this time, right? The strategy is we need to find someone who can reach out to those Rust Belt states, who can win the blue wall, who can go out there and just really be someone who can do something that's more bipartisan. So that could be the reason why, Biden, we don't, that's something you don't hear about in the media, right? But one of the big reasons why Biden could have really won this election is because of healthcare and because he was more of a proponent for the status quo.
Yeah. Hey, let's vocalize what clarification Dot you just made in case people aren't looking at chat. I want to make sure that nobody goes away hearing something different. And that was on, if you're looking, Dan, at chat, the pre-existing condition, just to explain specifically that, because I think there may be confusion on what we meant.
Okay, so I'm going to read here. My understanding of pre-existing condition is not that they can be denied coverage, but that the new insurance could decide not to cover any condition diagnosed prior to the effective date and receive treatment for in the prior 18 months. And yes, that's correct. Yes. So I may have said that too quickly, but I did not mean that they can deny coverage altogether, right? But just for that medical condition that's considered the pre-existing condition. So that was the clarification that Dot made, and that's correct. So I may have spoken too quickly there, but yes.
Yeah, I just want to make sure that was clarified. And also, I have a question. Would this red hue that I apparently have on screen be considered a pre-existing condition? I'm not sure.
I don't know.
feel like I'll have like a nice Irish.
Unusually sunny outside today. I mean, we're in the same geographical region of the country, but it's like unusually sunny out there right now, which is kind of nice, actually. It's really nice.
So it's 1:27, and I just want to make sure if there are any other questions that you have to put into chat. But clearly, as Dan had said, a couple of milestone dates coming up relatively soon. Obviously, Supreme Court decision, and then I guess it becomes when the cabinet, if assumptions are that what we are hearing, Biden presidency, House and Senate remain somewhat the same as they are, different members, that we start to see administration being put together, and you may start to get a sense of what's going to happen during the lame duck session versus what starts happening in 2021 that are going to affect everybody in this audience right now. So lot to look forward to over the next several months, right?
Yeah, we're going to be very busy. I think there's no question. Ooh, I'm hearing some feedback, but okay, we're good. So, but yeah, we're going to be very, very busy, no matter how you look at this thing, because there's going to be a lot of new cabinet picks, agency changes, lots of new rulemaking. I think it's going to be an all hands on deck effort as we just keep a.
All right. So one thing.
Yeah.
Question right here. I think it's a great ending question. What's the most important thing that can change that will affect employers and individuals? Only the correct answer will stand. Come on, you got to get this right.
Yeah, that's a tough one.
Well, the one thing, come on.
Yeah, look, a complete elimination of the ACA. Let's be realistic here, right? I mean, if the on November 10th, now remember, November 10th is just the date of oral argument, right? So really know necessarily how exactly this is decided on November 10th, but we could know as early as March or April of 2021. But that would be probably the biggest thing if the entire ACA is held unconstitutional, and then we all of a sudden everyone would have to scramble, right, to create a new healthcare system of regulation, right? We're talking about mountains of laws and regulations would have to be changed quickly. You know, hopefully, of course, any decision would give government some time to replace everything. You know, at least a year or 2 years to replace all of that stuff. But that would probably be the number one thing if the entire ACA is held to be unconstitutional and would have to be redone. That would just be a complete game changer, I would say.
Well, if there are any game changers in the future, I know that we'll have it covered with Dan, Dot, and the whole team. And we'll be bringing it to you as they occur so that you are in the know and can feel rest assured that you'll know how to navigate it with the team to support you. I want to thank everybody for joining the call. Dalia, I hope I pronounced your name correctly. Thanks for your questions. I really appreciate that. Dan, Dot, and for everybody here, have a great, safe, happy weekend. And let's hope, fingers crossed, for a nice transition as we get the election results finalized. All right.
Great. Thanks, Brian. Great.
Thank you.